Did you know that your brain cannot feel pain? When you have a headache, it's actually the tissues surrounding the brain that are hurting. This intriguing fact opens up the complex world of headaches, one of the most common health complaints globally. So if it's not the brain, what's causing that throbbing pain in your head? Let's find out. There are more than 150 types of headaches, but we'll focus on the most common ones today. Now, when we talk about headaches, they're broadly categorized into two types: primary and secondary. Primary headaches are those that aren't linked to another medical condition. They're the illness in and of themselves. On the flip side, secondary headaches are symptoms of another health issue. Let's dive into primary headaches. These are the ones that most of us are all too familiar with. They include migraines, tension headaches, and cluster headaches. Migraines are the notorious ones. They're like uninvited guests that overstay their welcome, lasting anywhere from 4 hours to 3 days. They're often accompanied by other unpleasant features like nausea, vomiting, and sensitivity to light and sound. Next up are tension headaches. Picture a tight band around your forehead or at the back of your head. That's what a tension headache feels like. It's the most common type of headache, and stress is often a huge trigger. Now, onto cluster headaches. These are the rarer kind, but they're known for their intensity. They occur in cyclical patterns or clusters and are marked by severe burning and piercing pain. They're so powerful that they often wake people from their sleep. Transitioning to secondary headaches, these are indicative of an underlying health condition. It could be anything from a sinus infection to a brain tumor. The headache severity and pattern, along with other symptoms, can provide clues to the root cause. For instance, a sudden, severe headache could signal something serious like a ruptured aneurysm, while a dull, constant headache that worsens with coughing or movement might suggest a brain tumor. Don't panic, though. These are extreme cases. More often than not, secondary headaches are triggered by common conditions like sinusitis or neck strain. Remember, it's not about self-diagnosis, but about awareness. Each type of headache has its own set of characteristics, triggers, and treatments. Understanding the type of headache you're experiencing is the first step towards effective treatment. Migraines aren't just severe headaches. They're a neurological condition with symptoms that can include nausea, light sensitivity, and even visual disturbances. Imagine being in the middle of your daily routine when suddenly your vision blurs, your stomach turns, and a throbbing pain engulfs one side of your head. That's a glimpse of what a migraine can feel like. Now let's delve into the intricate world of migraines. They're not your run-of-the-mill headaches. Migraines are often characterized by a severe pulsating pain on one side of the head, typically accompanied by nausea or vomiting, and extreme sensitivity to light and sound. These symptoms can last anywhere from a few hours to several days, making migraines a truly debilitating condition for many. Migraines are often triggered by certain factors, known as triggers. These can range from stress, changes in sleep patterns, to specific foods or drinks. Even hormonal changes in women can act as triggers. Speaking of women, it's interesting to note that migraines are 3 times more common in women than in men. So what's behind these intense headaches? Well, the exact cause of migraines is still a bit of a mystery. But scientists believe they're related to temporary changes in the chemicals, nerves, and blood vessels in the brain. As for treating migraines, the approach is often twofold. On one hand, there are preventive treatments aimed at reducing the frequency and severity of migraines. These can include medications, lifestyle alterations like stress management, and avoiding known triggers. On the other hand, there are acute treatments intended to halt the migraine once it's started. These treatments can range from over-the-counter pain relievers to prescription medications. Remember though, it's essential to consult your healthcare provider for a tailored treatment plan. Migraines can be a complex condition, and what works for one person might not work for another. Migraines can be debilitating, but with the right treatment, they can be managed effectively. So, if you or someone you know is dealing with migraines, take heart. There's hope, and there's help. Tension headaches, the most common type of headache, feel like a tight band around your forehead. Now imagine a clamp around your head, slowly tightening its grip. This sensation, often compared to a vice or a band pressing against the forehead, is what many experience during a tension headache. It's a dull, aching sensation that can extend to your neck, jaw, and even your shoulders, making it seem as though you're wearing a heavy helmet all day. What causes this discomfort? The answer might surprise you. The culprit is often stress. Yes, that's right. The pressures of daily life, whether it's work, school, or personal issues, can trigger these persistent headaches. They creep up on you, often gradually, and can last for several hours or even days. But don't worry, they're not usually a sign of something more serious. Now let's talk about how you can deal with tension headaches. The good news is that most tension headaches can be managed with over-the-counter pain relievers, such as ibuprofen or aspirin. These medications can help to relieve the pain and allow you to carry on with your day. But what if you're looking for a more holistic approach? Well, there are several options. Regular physical exercise can help to reduce stress levels, which in turn can help to prevent tension headaches. Good posture is also crucial. Slouching at your desk or craning your neck to look at your phone can strain the muscles in your neck and shoulders, potentially leading to a tension headache. Another technique to consider is relaxation therapy. This could be anything from deep breathing exercises to yoga, to simply taking a few minutes each day to relax and unwind. These methods can help to reduce stress and promote a sense of well-being, making them a valuable tool in the fight against tension headaches. Of course, it's always important to talk to a healthcare professional if your headaches are severe, frequent, or accompanied by other symptoms. They can provide you with the most appropriate treatment options and advice. While tension headaches can be bothersome, they're usually not severe and can be treated with over-the-counter pain relievers. Remember, your health is in your hands, and there are plenty of ways to manage and prevent tension headaches. So, don't let them hold you back. Cluster headaches, although rare, are one of the most severe types of headaches. Now let's delve into the world of cluster headaches and understand them better. These headaches are characterized by intense, debilitating pain that usually occurs on one side of the head, often around the eye. This pain can be so severe that it's been described as feeling like a hot poker being thrust into the eye. Yes, cluster headaches can be that intense. But what causes them? The exact cause is unknown, but it's believed they may be related to the body's sudden release of histamine or serotonin, chemicals found in the brain. There's also a genetic element, as they tend to run in families. And here's an interesting fact. Alcohol, even in small amounts, can trigger a cluster headache during a cluster period. So how can one know if they're experiencing a cluster headache? Well, the symptoms are pretty distinct. Apart from the severe one-sided pain, symptoms can include a red, teary eye on the affected side, a drooping eyelid, a runny or blocked nose, and a sense of restlessness. These headaches come in clusters, hence the name, where sufferers experience recurrent attacks for weeks or months, followed by periods of remission. When it comes to treatment, the aim is to relieve the symptoms, shorten the cluster periods, and prolong the remission periods. A variety of medications can be used, including oxygen therapy, triptans, and local anesthetics. Preventive treatments like corticosteroids or calcium channel blockers may also be recommended. But remember, every individual is unique. What works for one might not work for another. Therefore, it's vital to consult with a healthcare professional who can provide a personalized treatment plan. So, while cluster headaches may seem daunting, there is hope. With the right approach, these headaches can be managed effectively, improving the quality of life for those affected. Cluster headaches can be extremely painful, but with the right treatment, their frequency and severity can be reduced. So, don't lose heart. There's always a way to lessen the pain and lead a more comfortable life. Secondary headaches are symptoms of another health condition like a sinus infection or a brain tumor. Here's an interesting fact for you. Did you know that secondary headaches are not an ailment in themselves, but rather the messengers that signal something else is off balance in your body? Imagine them as the body's own alarm system, alerting you to possibly serious health issues that need your attention. Now let's talk about the symptoms. Secondary headaches can come in all shapes and sizes, from dull aches to sharp, debilitating pains. They might be accompanied by other symptoms too, like a fever, a stiff neck, or sudden changes in vision. The headache might be persistent, or it might come and go. The key is to listen to your body and not ignore these warning signs. So, what causes secondary headaches? Well, they're usually a symptom of another medical condition. This could be something relatively harmless, like a sinus infection or dehydration, but it could also be something more serious, like a brain tumor, meningitis, or an aneurysm. Even certain medications can cause secondary headaches. Now, this might sound a little scary, but don't panic. Remember, most headaches are not caused by serious conditions. However, if you're experiencing frequent severe headaches, especially if they're accompanied by other symptoms or if they're getting worse over time, it's crucial to seek medical attention. Here's the bottom line. Headaches can be a real pain, but they're also an important tool your body uses to communicate with you. So don't just pop a painkiller and ignore it. Listen to your body. If something feels off, it's better to be safe than sorry. If you're experiencing frequent or severe headaches, it's important to see a healthcare professional to rule out any serious underlying conditions. Remember this, your health is your wealth, so take good care of it. If your body is sending you signals, pay attention and take action. After all, prevention is better than cure. While headaches can be a real pain, there are many effective treatment and prevention strategies. From lifestyle changes to medications and other treatments, each type of headache has its own unique solution. Let's kick off with lifestyle changes. A balanced diet, regular exercise, and adequate sleep can work wonders in preventing headaches. Stay hydrated and limit alcohol and caffeine. Stress management, such as yoga, meditation, and deep breathing exercises, can also be beneficial. For those who experience frequent migraines, identifying and avoiding triggers is key. These may include certain foods, smells, or stressors. Keep a headache diary to help identify patterns and triggers. When it comes to tension headaches, relaxation techniques can play a significant role in both treatment and prevention. Regular physical activity can also help reduce the frequency and intensity of these headaches. Now let's talk about medications. Over-the-counter pain relievers such as aspirin, ibuprofen, and acetaminophen can be effective for many types of headaches. However, these should be used sparingly to avoid rebound headaches. For migraines, there are specific medications designed to reduce the frequency and severity of attacks. These include beta blockers, antidepressants, and even Botox injections. Cluster headaches, on the other hand, often require fast-acting treatments due to their sudden onset. Oxygen therapy and triptan medications are common treatments. In addition to lifestyle changes and medications, there are other treatments available. Physical therapy can be beneficial for tension headaches, while acupuncture and biofeedback can help manage migraines. It's important to remember that everyone is different, and what works for one person may not work for another. Working closely with your healthcare provider can help you find the best treatment and prevention strategies for your specific type of headache. In conclusion, while headaches can be a real challenge, they don't have to control your life. With the right approach, you can manage your symptoms and prevent future attacks. Remember, the best treatment for you will depend on the type of headache you're experiencing and your overall health. Headaches are complex, but understanding them is the first step towards finding relief. Today, we've journeyed through the maze of migraines, tension, cluster, and secondary headaches, shedding light on their unique characteristics and potential triggers. We've also explored various treatment and prevention strategies that can offer solace from the throbbing discomfort these headaches can bring. It's important to remember that while knowledge is power, it's not a substitute for professional medical advice. If you're experiencing persistent or severe headaches, it's essential to consult a healthcare professional. They can provide a proper diagnosis and a personalized treatment plan tailored to your specific needs. Headaches might be a common part of life, but you don't have to suffer in silence. Armed with the right information and professional guidance, you can take control of your health and find relief from the pain. If you found this video helpful, please give it a thumbs up and subscribe for more health-related content. Remember, your health is in your hands.